But we are not conducting additional research. And in fact, the World Health Organization itself is no longer conducting a leading study on brain cancer and mobile phones. Environmental Health Trust, the organization that I head, published an article in 2013 saying that we think that mobile phone radiation is a probable human carcinogen. And I want to show you briefly the reasons why we reached that conclusion. These are studies published since the World Health Organization IARC review in 2011. So these are newer studies. Here, Hardell from Sweden and Serenat from France. And what these are showing you is that the relative risk of developing brain cancer with more than 1,640 hours of lifetime use of a phone is almost 3 times higher compared to people who did not use mobile phones. Now I know this seems like very confusing. These numbers don't make a lot of sense to many of you, but really the way you get these numbers is it's like waiting for the grass to grow. You study people who have brain cancer and you compare them with people who don't have brain cancer, but they're otherwise similar. They're your controls, and you compare the people with brain cancer to those who don't have the disease, and you ask, well, do you remember whether you talked on the phone? It's not a very precise science. Actually, there's a lot of problems with what are called exposure misclassification. It biases you toward the null hypothesis. The reality is, it's a very poor way of doing research, but we don't have an alternative at this point. And what we need to do is to get the cooperation of telecom industry to get billing records. So we actually have real data instead of asking people to remember how much they use their phone. That's something that, again, you might be able to do in Australia, but I can tell you we can't do it in the United States, that's for sure. In France, they were able to do it a little bit better, and they were able to get these data here. And interestingly, if people started to use phones regularly before age 20, as most of the world is doing now, there was 4 to 8 times more brain cancer after they had passed 10 years. So now, why is there no increase in brain cancer that we can find in the general population today? Because there is not. And after all, if mobile phones really are important, why don't we have an epidemic today? Well, let me tell you why. First of all, brain cancer takes a long time to develop. How do we know that? We know that because when the bombs fell at the end of World War II, there was no increase in brain cancer in the survivors who had been studied. No increase at all. Until 40 years had passed. It took 40 years for an increase in brain cancer to show up in that highly exposed population. Now think about this. Today, the number of people using cell phones today and using them heavily today is very different than it was even 5 years ago, even 3 years ago. Now you're being encouraged to have unlimited talk and text, right? You didn't have unlimited talk and text 5 years ago or 10 years ago. So the uses and the users of phones are changing radically. In fact, most epidemiologic studies find no increased risk of brain cancer from mobile phone radiation. They don't. Until 10 years of heavy use. And by the way they define a cell phone user in these studies, I'm not making this up, is somebody who makes 1 call a week for 6 months. Yes, yes. 1 call a week for 6 months. That was the definition in these studies, which, by the way, don't find any increase. All right? So I'm not saying this to say that they did a bad job. I'm saying that we are challenged here with how do you do a study of something that's rapidly changing while you're studying it. The technology has changed. The way people have used it has changed. We never anticipated having infants and toddlers in cribs using these things. Nobody ever anticipated that. There's never been any modeling of the brain until we did this right now. And when I first said to my colleagues, by the way, took us 4 years to get this work done. And 4 years ago, I said, let's do that modeling. And they said, what are you talking about? Why would anybody want to model an infant or a 3-year-old using a mobile phone? I said, you wait, unfortunately. And so now we have a market, because the adult market is saturated. Australia already has more phones than people. It does. And so the market expands to the infants and toddlers. Now I want to share with you some of the work from my colleagues in India. Dr. Sharma is the Senior Deputy Director General of the Indian Council of Medical Research. And this work, Malka, I think will be of great interest to you because of the work on honeybees. We don't just have to wait for brain cancer to take 40 years to come up with answers. Honeybees have the advantage of being relatively easy to study, and there actually are established protocols for doing this. And I'm going to share with you some of these data, and they have been developed by colleagues from a number of countries. Honeybees have different characteristic dance patterns, and they have different jobs. There's the worker bees, and there's the bees that make the honey, and there's the bees that protect the queen. And I don't know all the details, but here's what I do know. If you try to study these under controlled conditions, you can take hives and put a mobile phone in some hives and a mobile phone in other hives that's not on. And what you can find is that after exposing the honeybees to an operating mobile phone, the workers don't come back to the hives. Now, this ought to be of great concern because agriculture depends on honeybees. I think you in Australia have a new business that's developed, I know it in the United States, where people drive trucks around with hives in it to fertilize crops. Have you heard of this? They drive them around because the honeybees are disappearing. Now, there are many different factors that affect honeybees. Climate is certainly one, pesticides is certainly another, but mobile phone radiation could be yet another, and we certainly need to find out if that is the case. 10 minutes of mobile phone radiation daily for 10 days, worker bees did not return to test colonies. And this would be something that could easily be replicated. So now we have to deal with the reality. There are many inconsistent results. I'm not just skimming the cream here and showing you the positive ones. There are a lot of studies that find nothing at all. Nothing. Why? Well, first of all, sometimes they study different cell cultures. So if you're looking for adult cells, they may be much more robust than if you're looking at neuronal stem cells. And that turns out to be the case. Sometimes they're using different exposures. If you're looking at continuous wave versus digital pulse signals, if you're looking at a square wave versus a sine wave. There's also another fact we have to talk about, which is yet another reason why I'm glad that Australia is not America. Sponsored research, this is to put it politely, can induce publication bias. Another way to say this is that where you stand on an issue depends on where you sit and who's bought your chair. And there's a tremendous amount of sponsored research by people who are hired to do studies to find no effect. And that's plagued this field in a number of countries, including within the government itself. So I don't know about the details here with Arpanza, but I can tell you in the United States today, the gentleman who is directing the Federal Communications Commission, Tom Wheeler, was for 10 years the executive director of the Cellphone Telecommunications Industry Association. And now he's in charge of regulating those devices. So it's challenging to have a neutral playing field under that circumstance. One example, the US Congress asked for a study of what needed to be done on mobile phone radiation in 1993, in 1998, in 2002, in 2012. That's how many times they've asked for that study to be done. So each time a study is done, and each time the conclusion is reached, we need more research. We need more research. Well, that's my bread and butter. Of course we need more research. But if instead of funding the research, all you're doing is calling for it, then it becomes a bit of a smokescreen. So that's part of our challenge on this issue. It's a lot easier to call for research than it is to carry it out. This research is hard to do. It's not simple. There are real complexities to this field. Unfortunately, at least in the past, industry had a very clear strategy. And in my book, Disconnect, I document and quote in the new afterword that in 1994, when industry first became aware that there were studies suggesting that mobile phone radiation could damage brain cells of rats, a memo was written to, quote, war-game the science. War-game the science. This issue is far too important to be gamed. It's not a matter of war. It's a matter of the future health of your children and grandchildren. And that's why it's really a special honor for me to be here today to talk with you about what could be done. Here are some of the policy responses that have developed so far. There are right-to-know laws and policies. Labeling is spreading. Headsets must be provided with all phones in a number of countries, and I'll get to those in a moment. There are changes in hardware and antenna design and software, operating systems that can be developed. And there are also changes to what we demand for proof, of evidentiary burden. Any lawyers here? Right. So the evidentiary burden that's being required for proof of harm is changing. Do you really want to have to prove that there's a significant increased risk of brain cancer before taking steps to reduce exposures to prevent that harm from happening? That's really the question. How much evidence do we need before taking precautionary steps? And that's what brings me back to my days at the National Academy of Sciences when we seriously looked at the evidence on passive smoke and airplane travel. We only finally took steps to act when it became clear that children of smokers were hospitalized more often. That was the evidence that we had to have. And I would suggest that at this point, we should be able to do better as a civilization. We start with, we need standardized ways to evaluate things. There is no standardized metric. That's something you could develop, at this school in particular. One of the other things that can be done, which our colleagues in India are doing, is to create cross-sectional surveys. In this room right now, you could divide this room up into people who are high, medium, and low cell phone users. There's probably nobody who doesn't have a phone or who will admit to it right now. But if you did look at people cross-sectionally and you looked at their memory and their reaction time and their reproductive health, you would learn a lot from that, and they are doing that now in India, and we'll talk some more about that in my conversations I'll have with some of the faculty later on. In the meantime, some schools are promoting wired school programs with shared banks of computers, and public educational efforts are really proceeding to let people know you shouldn't have to find that information buried inside your phone. I mean, come on. That's not fair. Parents, teachers, and health professionals should be informed, and they in turn can work with students to make sure people are using technology in as safe a way as possible. Now, here's some of the other policies that have been developed. In France, there's a ban on advertising to young children, under age 12, by the way. All cell phones have to be sold with earpieces. There has to be labeling of the specific absorption rate on phones, and there's got to be warnings. In India, they've lowered their tower limits to 1/10 that of the international standards, and they have official guidelines for cell phone use, using headsets and speakerphones. The Supreme Court in India has actually ordered a number of towers to be torn down. But it's a very tough battle to have to fight. Rather than having to get a tower torn down, there ought to be siting rules and policies that make sense. And in many countries, there are no real sensible siting policies. Israel, which is a country that has a lot of important issues to deal with right now, has a National Institute on non-ionizing radiation. They say no Wi-Fi in kindergarten. They prefer wired over wireless in schools. All phones, again, are to come with headsets and safety. And no advertising with children. In Belgium, the law has been implemented as of 2014. It was passed in 2013. No phones are to be designed or sold for children under the age of 7. Again, all handsets must be sold with headsets. And the sale to young children is specifically prohibited. Prohibited. Canada has issued practical advice as well. And I don't go into any more details here. These slides will become available on the website for the university, and we have much more detailed information I can share with you from our website as well. The Canadian Parliamentary Health Committee has urged that there be a recognition that this is a, quote, serious public health issue. And we agree. And I testified before the Canadian Parliament on this issue, and I was pleased to see their report agree with that point. Now, in the United States, a U.S. District Court has recently ruled that even if there is a reasonable possibility that cell phone radiation is carcinogenic, the time for action in the public health and regulatory sectors is upon us. And I think that that is a very important idea that we should all be aware of. Let's not debate the kinds of evidence we have now about brain cancer. I agree. That evidence can be debated. But we have enough evidence of damage, and these other countries have taken steps now. They can't all be dismissed. Berkeley, California has unanimously passed the Cell Phone Right to Know law. It's called an ordinance, requiring notification that if you carry your phone in your pants or shirt pocket or tucked into a bra when the phone is on, you may exceed the federal guidelines for exposure to RF radiation. This is a website that has all of the fine print warnings, so far as we know them, available. Environmental Health Trust is working with others to share this information. We hope you'll share it with all of your friends and family. This is the Baby Safe project that we have underway. And now, just so you understand that this is not a question of being anti-industry. Here's what industry is doing. Vodafone has to provide a report to the American government as part of their annual reporting to the Securities and Exchange Commission. They must report on what are called risk factors and uncertainties. And they report that they face risks because they may have to pay people for health damages. The last sentence there, a change to this view that there's no health problem could result in a major reduction in phone usage or major litigation. That's a risk. China Mobile, in their report to the U.S. Securities and Exchange Commission, they had to say, we cannot be certain that future studies will not impute a link between electromagnetic fields and adverse health effects, and because of that, it's a potential risk as well. AT&T says unfavorable litigation could result and require us to pay significant amounts of money. Well, speaking of money, would you give 2 cents? Would you pay 2 cents a month for every device you have, for every provider, for every manufacturer, in order to support the cross-disciplinary training program that is needed in bioelectromagnetics for engineers and physicians and computer scientists? That's what's needed to identify the data gaps, the research and development needs, to monitor the populations, to see what is happening to our children today, to look at hearing and memory and sperm count. That's what I think we need. We need a major program to fund independent research and training. Because I learned this way after I went to all that schooling you mentioned at the beginning, and it's not easy stuff to do. I hold my hat off to all of you electrical engineers. It's complicated. But in the meantime, people have a right to know how you can minimize exposure. And again, I think This information is available on our website, will be available on yours. Remember, if you have to give a phone to a child, put it on airplane mode. And think about this. That microwave oven, it works because there's a metal box around the microwave signal, and the signal pings all over the place. Next time you get into an elevator or a train for any length of time, put your phone on airplane mode. Otherwise, that signal is going all over the place, magnifying and coming back. Keep the mobile phone away from you when it's on and you are asleep. Now, it takes a village to do a lot of things. These are some of the people whose materials I've used today with their permission, and I can't read this list to you, but I want you to know that I feel really honored to be working with some of the most talented people in the world on this issue. And they have given me permission to share these materials with you. And I leave you with this thought from Albert Einstein. The world is not dangerous because of those who do harm, but because of those who look at it without doing anything. So, thank you.